You stand up, and for a moment, the room tilts. Your vision narrows, you feel light, and you grab the nearest surface. That quick head rush is usually your blood pressure lagging behind your movement. The key question is why it lags. Because you're low on fluid, low on electrolytes, or both. Your body is supposed to tighten blood vessels and speed up your heart within seconds. When that response is underpowered, less blood reaches your brain briefly, and you feel dizzy. Dehydration is the obvious suspect, but electrolytes like sodium and potassium are what help you hold on to water and maintain circulation. If you only drink plain water, you can still feel off. If you only eat salty foods but stay underhydrated, you can also feel off. So the goal is to separate the causes, watch your patterns, and know when dizziness is a warning sign, not just an annoyance. Moving to slide 2. Here's what should happen when you stand. Gravity pulls blood toward your legs and lower abdomen. That reduces the amount returning to your heart, so your next heartbeat pumps out a smaller volume. Sensors in your neck and chest notice the pressure drop. Within seconds, your nervous system responds by tightening blood vessels and slightly increasing heart rate. This is called the baroreflex, and it's basically your automatic anti-fainting system. If it works well, you barely notice standing up. If it's slow, you get that wave of dizziness, blurry vision, or a feeling of weakness. The symptoms usually peak in the first 10 to 20 seconds. They often improve if you sit back down or tense your leg muscles. The important takeaway is that the problem is not in your head. It's a circulation timing issue. And hydration and electrolytes both influence how strong that response can be. Moving to slide 3. Let's define dehydration in a practical way. Dehydration means you've lost more water than you've taken in, so your blood volume is lower. With less volume, your blood pressure is easier to drop when you stand. Even mild dehydration can matter if you're sensitive. Common triggers are sweating, diarrhea, vomiting, fever, long flights, or simply forgetting to drink. Caffeine and alcohol can contribute for some people, mainly by increasing fluid losses or reducing sleep quality. The signs are not just thirst. You might notice darker urine, dry mouth, headache, fatigue, or constipation. When dehydration is the main driver, dizziness often shows up after heat exposure, exercise, or a day of low fluids. It can also feel worse in the morning if you didn't drink much the day before. The core idea is simple. Low fluid means less pressure reserve when gravity hits. Moving to slide 4. Electrolytes are minerals that carry electrical charge, and they control how water moves in and out of cells. The big ones for dizziness are sodium, potassium, magnesium, and chloride. Sodium is especially important because it helps your body retain water in the bloodstream. If sodium is too low, you can drink plenty and still struggle to maintain blood volume. That's why hydration isn't only about water. It's about water plus the minerals that help distribute it. Electrolyte imbalance can happen with heavy sweating, endurance exercise, very low salt diets, or certain medical conditions. It can also happen if you replace lots of sweat with only plain water. Symptoms can overlap with dehydration, fatigue, weakness, headaches, but you might also notice muscle cramps, nausea, or a sense that you can't get rehydrated. The main point is that electrolytes are the plumbing and wiring that make hydration work. Moving to slide 5. So how do you tell dehydration from electrolyte issues in real life? Start with context. If dizziness follows a hot day, intense sweating, or stomach illness, dehydration is high on the list. If you've been drinking a lot of plain water, eating very little salt, and still feel lightheaded, electrolytes become more likely. Next, look for companion signs. Dehydration often comes with dry mouth and darker urine. Electrolyte imbalance can come with cramps, unusual fatigue, or a washed-out feeling despite drinking. Timing matters too. Dehydration dizziness often improves steadily as you rehydrate over hours. Electrolyte-related symptoms may improve only after you add sodium-containing fluids or food. None of this is a perfect test, but patterns are useful. If you track what you did the day before, heat, exercise, fluids, salty foods, you can usually narrow it down to the most probable cause. Moving to slide 6. There's also a third scenario. You're low on both water and electrolytes. This is common after heavy sweating because sweat contains water and sodium. If you replace only water, you may dilute sodium further. If you replace only salty snacks without enough fluid, you may not restore volume. The balance depends on how much you lost and how fast. People who work in hot environments, do long workouts, or wear heavy gear can end up here. You might feel dizzy when standing, but also notice headaches, low energy, and reduced exercise tolerance. The fix is not extreme. It's usually steady fluid intake paired with sodium-containing foods or drinks, especially around the period of heavy sweating. The bigger point is that hydration is a system. Water is the liquid, electrolytes are the solutes, and blood volume is the outcome. If any piece is missing, standing up can expose the weakness fast. Moving to slide 7. Now let's talk about orthostatic hypotension, the clinical name for a significant blood pressure drop when you stand. You don't need a diagnosis to learn from the concept. It simply means your body isn't compensating strongly enough. Dehydration and low sodium can contribute by reducing blood volume, but other factors can contribute too, like prolonged bed rest, anemia, pregnancy, or certain heart and nervous system conditions. Some people notice it more after large meals, because blood flow shifts to the gut. Others notice it after a hot shower, because heat relaxes blood vessels. If you're older, the reflex can be less responsive. If you're very fit, your resting heart rate may be low, which can change how the stand response feels. The key takeaway is that dizziness on standing is a symptom with multiple pathways. Fluids and electrolytes are common, but not the only possibilities. Moving to slide 8. A related condition you may hear about is POTS, postural orthostatic tachycardia syndrome. The hallmark is a big heart rate jump on standing, often with dizziness, palpitations, and fatigue. Some people with POTS benefit from careful hydration and higher sodium intake under medical guidance because blood volume and vessel tone matter. But it's not the same as simple dehydration. In POTS, the nervous system regulation of circulation is part of the problem. People may also have temperature sensitivity, brain fog, or symptoms that persist longer than the first few seconds after standing. The reason to mention POTS is not to self-diagnose. It's to recognize that if your dizziness is frequent, intense, or paired with racing heart and exercise intolerance, it deserves a proper evaluation. Hydration strategies can help some symptoms, but identifying the underlying pattern is what guides safe next steps. Moving to slide 9. Let's get practical with a safe, common-sense approach to hydration. First, spread fluids across the day instead of chugging a huge amount at once. Your body absorbs and uses it better. Second, match intake to losses. If you sweat heavily, you need more than someone sitting in a cool room. Third, use simple feedback. Pale yellow urine often suggests adequate hydration for many people, while consistently dark urine suggests you may be behind. Fourth, consider timing. If mornings are your worst time, a glass of water after waking can help some people. If workouts trigger dizziness later, drink before and after, not only during. The goal is stability, not perfection. Overdrinking can also be a problem, especially if it's all plain water and you're losing sodium in sweat. So think in terms of steady intake and appropriate replacement, not extremes. Moving to slide 10. Now, what about electrolytes in a normal routine? For most people eating a varied diet, electrolytes come from food. Salt, dairy, fruits, vegetables, beans, and nuts. Sodium is the one most tied to blood volume, but it's also the one many people already get plenty of. The tricky part is that needs change with sweating. If you're losing a lot of salt through sweat, adding some sodium around that window can help maintain circulation. Practical options include salted meals, broth, or an oral rehydration-style drink, especially after heavy sweating or stomach illness. Potassium is more about overall muscle and nerve function, and it often comes from foods like potatoes, bananas, and leafy greens. Magnesium is involved in muscle relaxation and can be low in some diets. The point is not to megadose supplements. It's to use food-first strategies and targeted electrolyte support when losses are high. Moving to slide 11. If you want an at-home way to check your pattern, you can do a simple orthostatic self-check. The idea is to compare how you feel lying down versus standing, and notice whether symptoms happen fast or linger. You can also measure pulse if you have a watch or monitor. Rest quietly for a few minutes, then stand and note your pulse at about 1 minute and again at 3 minutes. A modest rise is normal. A very large jump, especially with strong symptoms, is a clue to discuss with a clinician. Also track triggers: heat, alcohol, poor sleep, large meals, and long periods of sitting. Small behavior changes can reduce episodes, like standing up in stages, tightening your calves and thighs before you rise, or pausing at the edge of the bed. These are not treatments. They're simple ways to reduce the sudden demand on your circulation. Moving to slide 12. Some dizziness deserves quick attention. If you faint, hit your head, or have chest pain, severe shortness of breath, or a new irregular heartbeat, that's urgent. If dizziness comes with one-sided weakness, trouble speaking, or sudden severe headache, that's also urgent. For non-urgent but important patterns, talk to a clinician if episodes are frequent, worsening, or interfering with daily life. Also bring it up if you have known heart disease, diabetes, neurological conditions, or if you're pregnant. And if you've had recent vomiting or diarrhea and can't keep fluids down, dehydration can escalate quickly. The reason for these warnings is simple. While dehydration and electrolytes are common, dizziness can also reflect anemia, blood pressure problems, or medication effects. You don't need to panic, but you do need to respect the symptom. The goal is to rule out serious causes and then dial in the basics: fluids, electrolytes, and triggers. Moving to slide 13. This is a simple mental model. When you stand, your body needs enough blood volume and a fast reflex to keep pressure stable. Dehydration lowers volume. Low sodium or electrolyte imbalance makes it harder to hold onto water and maintain circulation, especially after sweating. The most useful move is to look at your triggers and your response. Do symptoms follow heat, exercise, or illness? Do they improve with steady fluids? Or only when you add salty foods or an oral rehydration-style drink? Also pay attention to how often it happens and how intense it is. If it's occasional and clearly linked to low intake or heavy sweating, basics may be enough. If it's frequent, severe, or paired with a racing heart, get checked. One last thing, stand up like you mean it, but not like you're in a hurry. Give your circulation a second to catch up. If you want more videos like this, subscribe. And in the comments, tell me which fits you more often, dehydration or electrolytes, A or B.